Okay, so we're into the results of the Rosenhan Being Sane in Insane Places study. And it's important to remember that our participants are the 12 hospitals and the pseudo-patients are recording the behaviour of staff within those hospitals. Now, the pseudo-patients found the whole experience extremely unpleasant and they were very nervous and uncomfortable when they first went in. But it wasn't because of their experience of the patients, it was more the experiences they were having with the staff. It was found that there was instances of serious physical abuse to patients. Rosenhan reports having watched a patient being beaten simply by asking an attendant or telling an attendant rather that they like them. There was acts of violence tended to go unchallenged. There was often verbal abuse reported. For example, they used select words to wake patients up in the morning. Patients' privacy was minimal, and the patients suffered loss of power and depersonalisation within this situation. They felt as though they were invisible or unworthy of account, and this threatened their sense of identity. Now, the pseudo-patients, their role was to take lots of notes. Note-taking behaviour was reported by the staff. So they've been concerned about their constant note-taking that was set by Rosenhan. So what they did was they came up with plans to get rid of the notes, but they found after just a day that this was not necessary, that the staff actually didn't notice or didn't classify the note-taking behaviour, certainly didn't read the notes. So none of the staff asked them what the notes were, but simply assumed their behaviour was part of their illness, being diagnosed as schizophrenia. For example, in one case, a comment, patient engages in writing behaviour, was inserted in the daily case notes as if it was some bizarre and explicitly symptom of the patient's illness. On another occasion, a patient making notes was told gently by a doctor, "You needn't write it. If you have trouble remembering, just ask me." And that was when one of the pseudo-patients asked him what the drugs were for that they were given on a daily basis. So the note-taking was observably normal for someone studying in the hospital, was expressed by the real patients. Many of them suspected that the pseudo-patients were checking up on the hospital. So the staff didn't notice that the writing behaviour was unusual. They just thought it was part of the schizophrenia. But the patients in the 12 hospitals, they did see it as unusual and suspected all along that they were fake patients. So what we're finding here is labelling. The staff's descriptions of the patients and the pseudo-patients were drastically affected by the label of mental illness that they had. Anyone who has been in the hospital will know that it can be very boring. You can adapt yourself to getting through the day by moving from one routine activity to another, and mealtimes provide a way to structure the day. So you find yourself bored in a hospital, looking forward to 3 o'clock and almost looking a little bit obsessed with getting your custard cream at 3 o'clock. And on one occasion, patients waiting outside the cafeteria for lunch were observed by a doctor, and in the case notes to this were displaying oral acquisition nature of the syndrome. And Rosenhan commented it seemed not to occur to him, the doctor, that there were very few things to anticipate in a psychiatric hospital besides eating, but they didn't see it as boredom, they saw it as a symptom of their mental illness. Another example of staff failing to recognise the situational impact on behaviour was noted when one of the pseudo-patients was pacing the long hospital corridors. A kindly nurse approached him and asked, "Nervous, Mr. X?" "No, bored," he said. The nurse assumed that his pacing was a symptom of his disorder rather than his response to the unstimulating and monotonous environment that he was in. One pseudo-patient talked about his upbringing and family, which seemed a typical example of how we experience changes in our relationship and our parents as we get older, getting closer to one, etc. All of this was seen as sort of a cause of schizophrenia, but it wasn't unusual. Remember, the pseudo-patients, all they did was change their name. Their life history was normal. If a patient went berserk because they'd been intentionally or unintentionally mistreated by an attendant, a nurse coming along would not inquire as to what had happened to lead to the outburst. It seemed not to be an option that the behaviour result of the environment factors impacted on the patient. It was more the disposition of the person and the illness that they were labelled with. Now, Rosenhan reports that 2,100 pills were handed out to the pseudo-patients during their stays in the hospitals. Although all but 2 were pocketed or flushed down the toilet, the pseudo-patients often found medication of other patients also flushed down the loo before they did theirs. but it didn't seem to bother the staff. As long as the patient's behaviour was okay, acceptable in the wards, it just got ignored, that the patients weren't taking their drugs. Now, the staff tended to keep themselves away from other patients, and this is something that we'll go into in the next lot of results. We'll go into more depersonalisation. There are a lot of results to Rosenhan. If you think some of the the pseudo patients were in there for a substantial amount of days, there is a lot of content to the results of the Rosenhan study, so I'll spread it out over 2 pearls. So this is pearl for results 1.